Hello everyone. In this video today we will discuss about the importance of vitality in importance of vital force. For comprehension sake we will we will refer it as vitality. So important of vital force in our day-to-day clinical practice. If you are new here, I am Dr.E.S.Khan, founder of OrganonEasy. The motto of OrganonEasy to promote the homeopathic practice among the students of homeopathy, and that a practice based on homeopathic cardinals, homeopathic principles. So we are trying to decode homeopathic philosophy and make practice easy. That is all about OrganonEasy. So the vital force have been discussed in 5th and 6th edition of Organon of Medicine, from aphorism number 9 to aphorism number 16. I won't go to the basics of these. The definition is in aphorism number 9, that the characteristics are there. What is vital force? It is actually the spiritual force, the force which we cannot see, the dynamic force which we cannot see, which is animating the material body. Okay, without this vital force, without this unseen force, the body is dead. What is the difference between a person who was living and a moment ago and is dead a moment after? This is the vital force. We can explain it with the concept of Atma, with the concept of Ruh, with the concept of spirit, but we will not go in that detail or philosophical detail or academic detail, but rather we will try and understand what is the use of this vital force in our day-to-day clinical practice. You will see there are difference of opinion among the stalwarts of homeopathy that whether this vital force is the concept or understanding of vital force is necessary for our day-to-day practice. Like Richard Hughes and R. Degen, they are of opinion that it is not at all necessary. The similia is the only principle which is necessary and which is cardinal to the homeopathy, and this is needed for our day-to-day practice. But there are many who are of opinion that understanding the vital force will help you in easy prescription. Okay, I'm of that opinion that yes, this understanding of vitality of patient is very much important. We will see how this theory of vital force was incorporated in 5th edition of Organon of Medicine, but the concept was there in the mind of Hahnemann before that also. In preface to 4th edition, second last paragraph, you will see that vital force has been termed as misnamed nature. So there was a concept before, but Hahnemann was thinking before that it is not at all the vital force which is facilitating the cure, rather the remedy which is doing all the thing. But later on he discovered and realizes that no, the cure will be certain and rapid in proportion to the strength of the vital force still present in the body. Clear? The reference is preface to 5th edition, 5th paragraph, 7th line. The cure will be certain and rapid in proportionate to the strength of the vital force still present in the organism. So this vitality, the strength of the vitality will decide how far this cure is going to be, how much this cure is going to be rapid. Okay, so what vital force is doing? Vital force has role to play in health. It is the vital force which is ruling with unbounded sway in the whole organism, that a prick in the toe will be sensed by you. It is the vital force. In the language of science you can say the distribution of nerve faculty, distribution of nervous faculty everywhere in the body, that is giving you sense of a whole, that is giving you a freedom, feeling of freedom, that you are not if you are having pain, you are feeling that if you are not having pain, everything is going on inside our body. Digestion is going on, respiration is going on, and cardiac system is going on its own, blood circulation is going on its own, but you are you are not feeling that senses. Otherwise, if you can feel your heartbeat, it is called palpitation, and you will be anxious of this. So this whole function philosophically is being termed as vital force or vitality. This is the vitality which is going to produce the symptom. If it is sick, that is the role of vital force in health. If this vital force is sick, it is going to produce the symptom which is telling the physician that I am sick and I need medicine. Okay, so if this vital force is not strong enough, now this point is important. Who is going to produce symptom? Vital force. Okay, and who is going to utilize these symptoms? Physicians for his medicine. Now you will get patients with vague symptoms. Vital force is unable to produce symptoms, and in that conclusion will be that vital force is of having a low vitality, that the patient is unable to produce symptom that low vitality. Okay, you will see patients that he is unable to produce fever. You will see patient that unable to produce pain, but feeling sick, unable to produce the symptoms, but feeling sick inside, and the physician is helpless without these symptoms. Aphorism number 14, that every curable, vital force is being discussed from 9 to 16. If at some point of time we will discuss each and every aphorism in detail, but today we are just discussing the practical application of vital force. So aphorism number 14 is telling what? Go to content of aphorism number 14, telling what? Every curable disease will know itself by the signs and symptoms to the physician. If there is no signs and symptom, the disease is not curable. Okay, the vitality is so low, and if the vitality is low, now the application, vitality is low, you are not getting symptom. Vitality is low, potency should be low. Vitality is strong, potency should be high. Like high fever, high grade fever, flushes of red, patient is screaming with pain, and you will think of belladonna. Now what potency? You will think of belladonna 1m or 10m, but there are fever and not that much of fever, not that much of pain, but patient is feeling vitality is low. If you are thinking of belladonna, think it in low potency. Okay, so there are instances where vitality is suspended. Okay, for cure you need vital force in action. If the vitality is suspended, what we are doing? Aphorism number 67, footnote, we are doing some emergency measure to increase the vitality, to resuscitate the vitality. Otherwise your medicine is of no help. Okay, so vitality is needing medicine, and vitality is needed for cure. Clear? Now consider vital force as a friend of yours, a friend of physician, and is inside a room, and vital force is not, that person is not tied up from his mouth, not tied up from his hand, and ruling with unbounded say. For help, he can cry with the hands, he can clap with the hands, cry with the mouth, and do everything possible to let yourself, who is outside the room, to know that the vital force need help. So this is, lots of symptoms are being produced, but if the vital force is tied from mouth, tied with hand, and he is just making like noise, and you have to understand from that. So symptoms are less when the vitality is low, and you will expect a slow cure here. If the vitality is low, a slow cure is expected. Let your patient know that the vital force is so vitality is so sluggish, a slow cure. And to raise up the vitality, you may need some intercurrent, as has been discussed by Hahnemann in aphorism number 183, footnote, regarding opium. Open Allen's keynote, opium, first few lines, and you will get to increase the susceptibility. Where there is no susceptibility to the medicine, you are giving medicine and there is no effect of that. That shows what? That shows the low vitality. This low vitality may be due to the sickness itself, that mixed miasmatic diseases. As you will see in patients of carcinosin, you will get two kinds of patient of carcinosin. One who will complain that I have no fever, I have no illness, no acute fever since my childhood, and all of a sudden this pathology have been diagnosed and I am feeling no pain, nothing at all, but pathology is there and cure me of this pathology. This shows a low vitality with the dynamic pathology running inside, never knowing itself outside because of the low vitality. And this patient will need, if this is also a patient of carcinosin, maybe a patient of carcinosin with low vitality, and you will get patient of carcinosin contradictory to that, suffering from every and many acute diseases. This is patient of carcinosin with high vitality. One is needing a low potency, one is needing a high potency. So pathology will decide potency. This is not at all true in real sense. Okay, pathology may be there, and if the vitality is strong, you can prescribe a high potency. Pathology is there and vitality is low, you have to prescribe a low potency. Okay, clear? So potency selection is depending not on the pathology mainly, but on the vitality. If the vitality is strong, so many symptoms you are getting, and you can judge the vitality is strong, you can say that this patient, even if of a grave pathology, may need a high potency, and you won't expect a Kent's first observation here, because the vitality is strong, and even if you are giving 1M or 10M potency, that will be a lower for that vitality. Okay, so make it clear. I am referring this claim from my practical experience, whatever I am having, and from the writings of stalwarts like Stuart Close. Go to Stuart Close chapter postology, and you will get same thing there. Next, what lowers the vitality? Vitality is lowered by the sickness itself, and the vitality all of the sudden, in some sudden cases, blood loss, sudden accidents, sudden electric shocks like this, and by artificial diseases, artificial medicines. Okay, these medicines are also lowering vitality. If you are getting a patient of 10-year duration, suffering from 10 years duration and taking lots of allopathic medicines, lots of Ayurvedic medicines, the vitality deemed to be low, and think of low power, low potency in these medicines, in these type of cases. So up to this much today we will discuss, and some more philosophical topics from Organon of Medicine in our next video. If you want anything to be discussed, you can comment and share below. Thank you for giving your time.